When we dissect the heart of a calf, which is very similar to a human heart, we're going to put the apex of the heart towards you, the base of the heart towards me. The apex of the heart is the pointed tip, the pointed tip. The base of the heart is towards my head and neck, where the blood vessels are going to come out. The apex of the heart is towards you. This is the location of the right ventricle, left ventricle. Right atrium, left atrium. But the atria, both atria were cut, and all we see is the vessels coming from the base of the heart. This is the location of the IV septum, the intraventricular septum. Running in the intraventricular septum is a branch of the left coronary artery, and if I move my finger on it that way, you could see the blood passing through it to supply the ventricles. When we take a cut, we're going to take two parallel incisions, two parallel cuts from atria to ventricle, from atria to ventricle, from right atria to right ventricle, left atria, left ventricle. We opened the ventricles. We found that the thickness of the right ventricle is about 1/3 of the thickness of the left ventricle. So left ventricle is 3 times as thick as the right ventricle. We have a band in the middle or the bottom of the right ventricle called the moderator band. Moderator band is only in the muscle of the right ventricle. Okay? Inside the ventricles, both of them, there are ridges called trabeculae carneae, and we also see a bulky muscle called the papillary muscle. We have a papillary muscle, and attached to the papillary muscle are these shiny tendons, which we call the chordae tendons. Okay, let's look at this open, the heart that was dissected. Open more. Look at the papillary muscle and the papillary muscle attached to a tendon. Okay, and this tendon is attached to the leaflet of the mitral valve. Let's close this heart and look at the mitral valve. The mitral valve is located between the left atria and the left ventricle. And the mitral valve forms a leaflet here and a leaflet here because it only has 2 cusps. And I'm going to be moving my finger with the mitral valve when the chordae pull on it. So when the papillary muscle pulls the chordae tendineae, the leaflets of the mitral valves are gonna open like this. Who's pulling from the bottom? It is a tendon. Mitral valve contracts, pulls on, papillary muscle contracts, pulls on the tendon, mitral valve is going to open. Same thing in the tricuspid valve. Tendon pulls on the valve. Tendon pulls on the valve when the muscle contracts. Okay? The exit of the left ventricle. Is the aortic valve. And the aortic valve goes out to give the aortic blood vessel all over the body. 3 branches and then all over the body. The aortic valve does not have cusps, it's got cups. So you got a cup, and a cup. And it's cup shaped. And you see the root of the aortic valve, or the aortic blood vessel. Okay? From left ventricle to the outside is the aorta. From right ventricle to the outside, my other side, my right thumb, is the pulmonary vein. Okay? Close the heart. Let's look at these well dissected papillary muscles and tendons. Papillary muscle, tendon, mitral valve on both sides. Okay?